Welcome to today's Global Connections program. I'm Bill Miller. Today we're going to take a look at the United Nations Children's Fund and see what it's doing in the health area as far as providing maternal and child health care services. My guest today is an expert on this program. Today we're going to be talking with Dr. Stefan Peterson. Dr. Peterson, a Swedish national, is the chief of the health section for the UN Children's Fund based in New York. He's a professor of global health at Uppsala University in Sweden. Dr. Peterson, welcome to today's Global Connections program.
Thanks, great to be here.
I appreciate you being with me. We're going to get into your health section in just a moment, but let's talk in a more generic manner and talk about the United Nations Children's Fund, UNICEF. And I would imagine UNICEF is probably the best known of all the UN agencies, that whole myriad of alphabet soup agencies. But what is the main purpose of UNICEF?
Now, UNICEF is about children, and in many ways the Convention on the Rights of the Child is one of our better foundational documents. And these days, coupled with the UN Secretary General's strategy, we're focusing not just on children surviving, but also children thriving and developing. So we're for the interest of the child.
Now, our viewers can go to your website at www.unicef.org. You mentioned your job. I remember you said the rights of the child. That was a document, an international agreement that was getting great discussion back around 1998, I think it was. Basically, we won't go off on that for the whole show, but basically, what was the thrust of the Convention on the Rights of the Child?
The thrust is that all programming and all country legislation and countries should safeguard the interest of children through all of what they do, and that children actually have rights. And so it was to actually empower the child, and there is an elaborate monitoring mechanism actually as to what extent countries and states live up to those rights.
Exactly, and the way of looking at children is changing. It's evolving over the years. Children do have rights, they have responsibilities too, but they certainly have certain rights. Well, let's talk about the health section. What is the UNICEF health section that you head up?
Now, we're actually one of several sections, obviously, a big one. We have a global turnover about $1.5 billion. We're in 7 regions around the world, and do health thing in about 125 country offices across the globe. And it's about, again, children surviving, but also children thriving and developing their brains and their potential. So our job here from New York is to write strategies, support our regional colleagues and country office colleagues, in turn to support governments to realize the rights of children in this field.
So how do you bring that network together? That's a very extensive network with the governments, with your regional colleagues, with probably some other partners too, maybe non-governmental organizations. How do you bring those together to focus on this particular problem?
Now, I think from my perspective, and my job is about half of it is actually managing those global partnerships that you referred to, and half of it actually is supporting more operational issues through my regional and country office colleagues. And actually once a year we bring the 7 regions together, 7 regional advisors together, actually, so that we actually have a chance to know each other at a very social level and not just on telephone and web link as for the rest of the time.
Right. They get together from time to time. Well, you have the 2 goals we were talking about, and one is to end preventable maternal, newborn, and child deaths. What are some of the programs that are in place to do that?
Can I address that in 2 buckets, actually?
Sure, please.
One is that we've been fighting malaria, pneumonia, diarrhea for long, and unfortunately we're not done. We're still losing 900,000 kids this year, largely predictably to pneumonia, 500,000 to diarrhea, and some 300,000 to malaria. And it's on the one hand for failure to prevent kids from falling sick, be it through immunization, the kids that don't get immunized, although we do immunize 4 out of 5 kids in the world, 1 out of 5 don't, sleeping under a bed net, eating good food, etc. But on the other hand also, once you have that child in front of you with a high fever, is that high fever in the middle of the night? I'm sure you have kids or had kids and you remember in the middle of the night. What's causing this fever? Is it pneumonia? Is it diarrhea? Is it malaria? Sorting out what it is through the health services and giving the correct treatment. So those are some of the challenges in the older child, if you will, with the remaining infectious disease burden there. But then,
please, go ahead.
The second bucket I'd like to bring is that as we increasingly actually address successfully that febrile child, prevention and international management, we see that the newborn mortality, and coupled to the maternal mortality and the very dangerous thing called delivery, both for the mother and the baby. We lose 2.6 million kids on the day of delivery, in the first month of life, and most of those are actually on the day of delivery. And another 2.6 million kids die as stillborn, about half of those during the act of delivery. And that's actually all linked to the quality of delivery care. In many places, we've convinced 2 out of 3 women come to health facilities to deliver now, but then we fail them on the quality in so many countries. So it's a shift of focus, if you will, from just access to actually the quality of the care as well.
Mm-hmm. When you're talking about malaria, you're talking about pneumonia and different ailments such as that, and these are major problems, but these are ones that can be dealt with, can they not, if they have the proper financing, that type of thing, to focus on it, to get the players to work together?
Yes, in the SDG era, a lot of the focus now is actually the focus on the country. And much as we have an international system, and I agree with you, we need to be coordinated to actually help governments to provide better services. The importance of domestic financing and getting domestic priorities right and building national capacity to address this in policymakers, in implementers, as well as local researchers to, as my tired parable goes, fix the airplane as you're flying it. And that's increasingly where we're focusing our attention.
That's right. Overhauling a motorcycle while the motor's running.
Totally.
Which is very difficult to do.
Yes,
Extremely
but I think it's much better than waiting for the crash and then doing a thorough evaluation of why you crashed, isn't it?
It certainly is, yes. That's very true. These problems are, well, let me ask you, are we making headway in some areas? I know when we think back from 2000 to 2015, we had the Millennium Development Goals that focused on some of these issues. We now have the Sustainable Development Goals from 2016 to 2030, which we'll talk about in a moment. But are we making progress in certain areas? Are there certain countries that are doing well and have some best practices? Maybe some other countries are not doing well, and we should look at why they're not. Of course, in a war zone like Syria or Yemen, you can certainly see why people are not doing well. But are there certain areas that are doing better, or making progress, and there are some best practices?
I think you can actually say uniformly that the world has never made progress as quickly as we did in the MDG period. We went from, when I started in this business, we said 12 million under 5 deaths per year. And then at the end of the MDG period, we said, well, actually we're now at 5.6. So we've halved the mortality in 25 years. And I think that's unprecedented. And that's actually been across the world. But as you allude to, of course, the humanitarian and the conflict settings is where we lose a lot of kids. And when we deliberately start bombing out health facilities and water points, as in Yemen and many other conflict points now, that obviously reverses a lot of the gains that are made.
And as you look at this whole picture, and you've seen the successes, the failures, and everything in between, what would you recommend that we do to make sure that we're more successful in the future? First off, stop the wars. That goes without saying, I guess. But what else do we need to do to get the UN involved, to get your partner agencies, to get governments involved, the private sector, non-governmental organizations, anybody that has an interest?
I think the SDG agenda is actually very good in that it recognizes that everyone has a role in there. But I think the centrality of this is actually the leadership in the affected communities. However well-meaning we are in New York, me flying in and helping someone, a few kids sort of on the ground, it has to be owned domestically. And ultimately, that will be about empowering citizens to demand their rights and setting up accountability mechanisms whereby that poor, impoverished farmer woman doesn't need to confront the health worker who hasn't given adequate service, but that we can actually help the accountability piece. To me, that will be a big one. So when healthcare becomes politics in countries and politicians campaign on bringing good health service and good education, then I think we're on the way on the right track.
Well, thank you for making the segue into the Sustainable Development Goals. That's basically the foundation of everything we're going to be talking about for the next 14 years. And of course, it was in 2015, I guess it was, the UN General Assembly, all 193 member states approved the Sustainable Development Goals and the development agenda for for 2030, and there were 17 logical, practical goals to eliminate poverty, to eliminate hunger, to combat climate change, to provide quality education, to empower women. There are 17 of them. We won't go through all of them, but which of those are the most applicable? I'm sure they're all applicable to what you're doing, but are there 2 or 3 that you really focus upon to bring into your work and into your planning?
Yeah, I think arguably teachers are more important for health than health workers. So I think actually coupling together education, nutrition, water and sanitation, what we call multi-sectoral determinants of health. Because we estimate that about half of the health gains we've made in the MDG period in child survival actually come from other sectors than the healthcare sector. So it's actually bringing those relevant sectors together and realizing that, as my Ugandan teacher and mentor Francis Omaswa used to say, health is made at home, hospitals are for repairs. So how do we enable parents actually to be able to bring the best for their children, not just to survive, but also to thrive?
Exactly, right. It is something that we need to focus much more on than we have in the past, that's for sure. But as you mentioned, progress has been made, and that's the important thing. At least we're moving forward, but of course there's always a new challenge every day. As you've worked on this program over the years, what do you see as maybe some of the not just success stories, but what's coming up in the future that can be done a little bit differently to help change the ground situation, to make sure there are more successes on the ground? Are there certain things that you would like to implement?
I think it's an exciting year because we're 2018. It's 40 years since the groundbreaking primary healthcare declaration in Alma-Ata. And we're going to celebrate that together with the WHO and the government of Kazakhstan. UNICEF is organizing a 40th anniversary where we actually want to bring out primary healthcare 2.0, as we call it. And that emphasizes actually bringing health services, the preventive, promotive, as well as curative, to within reach of where you live. Personally, I like to talk about the first mile health system. Not the last mile, but first mile from your door, when your kid is sick, when you need that immunization, etc. And it's actually bringing about that excites me this year. So it's about not tackling or going after individual diseases, but actually bringing those delivery systems close to where people live and with sufficient quality through primary health care. So that's what's exciting me and what I think is the way forward.
And it certainly is. That's the way we should be moving. Well, you're watching Global Connections Television, which is a privately funded, independently produced program. The opinions expressed on Global Connections are solely those of the moderator and his guest. We would invite our viewers to go to our website at www.globalconnectionstelevision.com to view previous programs. Also, if you're involved with any type of PBS or community access television station, or you just have a website and you want to share the programs, please feel free to do so. Global Connections Television is provided free of charge as a public service. Today we're taking a look at the United Nations Children's Fund and what they're doing to provide maternal and child health care programs. And my guest today is an expert on this particular agency. My guest is Dr. Stefan Peterson, and Dr. Peterson, a Swedish national, is currently the chief of the health section for the UN Children's Fund based in New York. You have a myriad of programs that are out there. One that I read about very briefly was Every Child Alive campaign. What exactly is that?
Now, we want to actually, through campaign mode now, draw attention to the fact that proportionally newborns are a bigger and bigger part of the child mortality that is remaining that we need to tackle. So we want to make sure that it's actually that quality antenatal care and quality delivery care is available that will serve both the mother and the baby. And we're actually talking about 4 Ps in this campaign. It's about place where you should go and deliver, a health center which has running water and electricity. We're talking about person, a midwife who is competent, just not skilled. Just didn't go to a midwifery school once upon a time, but is actually competent and up to date, who has about 10 key products, starting from soap to wash your hands to a bag and mask to revive the kid, and to an empowered woman who's not just a passive recipient. So that's how we're trying to actually bring attention to this and also have some programmatic message of what it will take to change this situation.
Do you have a feel for how many people will be affected by this, or what's your target population? How many UNICEF workers are on the ground, that type of thing?
Now, the campaign is a global one, but we're actually focusing on 10 particular countries to actually try to overcome some of the policy blockages and actually bring attention to this on the ground in the countries.
It sounds like a very important program. Yeah, and there's so many of these problems that can be dealt with very inexpensively. For example, you're talking about washing your hands. That's basic if you can do that, and that can prevent a lot of diseases. Or perhaps having a malaria net that costs $10 or $15 can save
Actually,
a life.
it's down to $1 at
Oh, is it
some
really?
places.
Really? That's remarkable. Yes. And those are things that can be done very easily. And of course, people can contribute to UNICEF. There's, you do accept contributions or through U.S. Committee for UNICEF.
No, totally, and thanks for bringing that up, because it's actually private contributions that gives us the flexibility of going and fixing problems, whether we have a government grant or not. It's private viewers that give contributions, that buy our Christmas cards or whatever and do trick or treat for UNICEF. They are the ones that give and maintain that flexibility. So it's a very important contribution and enabler of our work.
You mentioned Trick or Treat for UNICEF, which is a very popular program, and that's one of the main reasons UNICEF is so well known in the United States and around the world.
Yes.
So we're talking about health programs, and one that I find near and dear to my heart anyway, because in full disclosure, I've been involved with Rotary International for years, and the one that Rotary started in 1985, the Polio Plus program, to eliminate the scourge of polio.
Yeah.
And Rotary had raised about $120 million to do it, and then by 1987 realized it needed more help. So it went to the UN Children's Fund, the UN World Health Organization, Centers for Disease Control, then came in later with the Bill and Melinda Gates Foundation. And today that is now the largest health program, international health program ever undertaken. And it went from like 250, 300,000 polio cases in 1985. We're down to what, 30 today or something less than that. That's a remarkable program.
It is, and we're actually on the finishing stretch. This year so far we're counting 8 cases.
8 cases.
Yes, and we're down to 3 localities. It's Afghanistan, it's Pakistan, and it's northern Nigeria, where we're still chasing polio and polio transmission. So it's a remarkable human feat, and polio is going to be the second disease that mankind puts behind itself, the first one being smallpox. So, in fact, Rotary paid my MPH scholarship once upon a time to go to a school of public health.
Oh, really?
So Rotary has made a great contribution, and it's an example, I think, of many partnerships of that kind that chase various initiatives. With Kiwanis, for instance, we're chasing neonatal tetanus. Now, we hope to finish polio. Of course, we've said that for a couple of years now. And of course, when I mention northern Nigeria, Boko Haram, Afghanistan, and Pakistan, we realize that what actually some of the problems are keeping us from finishing the job is access and insecurity.
Exactly. I remember that was one of the problems. I think it was the Kano state or Kano province, I may be wrong on that, that there was some disagreement as to whether UNICEF workers should be able to come in to immunize children. And that's what you run into. They eventually were. But as I recall, Secretary General Kofi Annan had to get personally involved in that to help make that happen. But that's what you run into in some areas of the world. Well, for example, in the United States, there are lots of raging debates on immunization. Some people, for religious reasons or whatever, do not want their children immunized. They believe it may cause autism or whatever. Do you run into that all around the world? That you have cultural issues, health issues, religious issues?
I don't want to overstate those issues, and of course there are misconceptions, and to some extent the internet and social media actually allow them to be propagated. But I'm also looking back to my own childhood. It's about how we relate to governments and so on. For even in a relatively educated and developed country like Sweden, in the 1960s when I grew up, my parents just followed the state immunization program. And these days, many middle class educated parents feel that they have to start making personal decisions about which vaccines to take, and then you end up in these mess discussions. So Yes, it's something we have to tackle around the world, but I don't think we should overstate the issue of it. And I think the vast majority of parents see the value of immunization, because I think it's unprecedented what we can do with it.
Before we leave the polio, just one, and these statistics may be out of date, I haven't heard new ones recently, but I remember at the beginning we were talking about 300,000 cases of polio, and today you mentioned there are 8. Back then, millions of people were adversely afflicted with polio. When this program ends, there'll be at least 50,000 children's lives saved every year, and the taxpayers in the United States will save over $250 million. Taxpayers around the world will save $1.5 billion every year that they don't have to spend on anti-polio programs.
Yes.
So it is a huge program, and it's just, as they say, as Dr. Jane Goodall would say, we're just that close.
Yes,
we're
we
just
are
about to get it.
But you know, there's one element actually that I deal with also in programmatic acceptance when you're on the finishing line, because you're chasing something that has ceased to be a problem to the local community. And that means that you need to broaden your service provision. So whether you're chasing the last cases of polio, or as the Gates Foundation is putting out there, why don't we eliminate and eradicate malaria? The less you have of a condition, the more integrated you need to be to maintain that relation to the community, so that it's not just Bill who's coming to chase me for the umpteenth time for something that hasn't been a problem around here for many years, but it's part of a broader service package. So those are some of the challenges I see for the last stretch. But I agree, we should definitely finish this, and we should celebrate as mankind.
Now, Global Connections Television focuses on many issues. We have a myriad of issues, but 2 that I really try to focus on a little bit more. One is climate change. The second is empowering women and girls. How does this whole climate change discussion play into what you're doing?
I think it makes the poor more vulnerable, basically. When the oceans rise, when the rainfall patterns change, etc., it's the poor who pay the price. The rest of us know how to compensate and insulate against those effects. So definitely it is an issue. But I'd like to turn it around and also say that the climate change issues also depend on human development, because as long as my kids are hungry and sick, I'll sort of fell the last tree and fish the last fish. So I think we need to put the child at the center of the SDGs and of the environmental debate, for the child itself, because we care about children, but also as a symbol of the future. Because I think we're not saving the world for itself. At least that's me. I'm rather human-centered. I'm sure the cockroaches will do fine even when mankind is gone if we lose that game. So we need to keep the child at the center of the SDGs and save the environment with and for us.
And in the last minute or so, minute and a half we have left, why is it so important to empower women and girls to be involved in this discussion and in this battle against diseases or whatever it may be?
No, I think it's there are many magic bullets, as we hope to pretend, but if there's one intervention we should do, is sending girls to school and keeping them in schools, because they don't wage war. They are the future parents and the caretakers, and it's a fantastically good investment. We're also, by keeping girls in school, helping to reduce fertility. Because the later you start having kids, the fewer you will, with or without family planning or other things that might be acceptable or not in different cultural contexts. And we're also all about actually stabilizing the world population if we want to maintain that relationship in a planet that will sustain us into the future.
Now, in our last 30 seconds, what is your major challenge as you move forward?
I think it's to hang in there and actually keep the global momentum and the global solidarity up. And because we live in a time now when some countries and individuals think that they can go off and do it on their own. And if we can beat that actually misconception and say that it's only by staying together as mankind, humankind, we can beat these problems and have a sustainable future, that will be the challenge, I think.
It certainly will be. And of course, the United Nations Children's Fund has been in the forefront. on dealing with so many of these issues. We talked about polio, we went back to smallpox. The World Health Organization led the charge back then, but still, you and along with your partners have been very involved in these issues. You talked about the Convention on the Rights of the Child, again, a very important document that we need to bring back and remind people how important it is and how it's important for all countries to participate in it. But these are issues that affect our families, they affect our communities, they affect our states or regions, whatever, provinces, wherever you may live, and we all need to work on them together. And of course, our viewers can go to your website, www.unicef.org, and get more information as to what you're doing. And they can also go to the U.S. Committee for UNICEF to make contributions, tax deductible, I mentioned, contributions to the great work that you're doing. But Dr. Stefan Peterson, I want to thank you so very much for a very interesting and a very informative program.
Thank you.
Thank you. I'm Bill Miller. Thank you for joining us today on Global Connections Television.